health is to promote the distribution of burdens and benefits so that each person has the same opportunities to achieve an optimal state of health and well-being. Public health professionals understand that the least intrusive path can sometimes be the least effective. Mayor Bloomberg and Tom Frieden believe that this was possible through the use of abrasive government interventions. What Tom Frieden discovered when he became New York City's newest health commissioner is that 20% of the deaths within the city could be traced back directly or indirectly to cigarette smoking. Radical public health policy change was implemented to reduce the rates of morbidity and mortality among the city's residents. Those who are still smoking within New York City may be paying up to $13 per pack of cigarettes. That's $4,745 a year on cigarettes alone if you are a pack-a-day smoker. Not only will cigarette smokers continue to feel the financial strain, but they must face the public's negative perception of smoking. Tom Frieden saw that with the passage of the Smoke-Free Air Act, which bans smoking indoors, which now leads to a negative connotation of smoking and further decreased its rates. In 2013, mounting evidence suggested that trans fats were partly to blame for increased rates of heart disease, but the FDA was still allowing them in common food items. Tom Frieden denounced trans fats as unnecessary artificial substances that are hazardous to public health. He further declared trans fats were being ingested without knowledge or consent of consumers. After significant research, Tom Frieden and his department elected to ask restaurants to replace trans fats voluntarily. Some restaurants saw the need and removed trans fats from their food. Many did not. In 2006, the New York City Board of Health passed the trans fat ban unanimously, giving restaurants only 1 year to ban and remove trans fats from their recipes. At the same time, Tom Frieden argued consumers had no way of knowing the number of calories they were consuming when going out to eat. Non-nutritive, high-calorie food was directly contributing to the obesity epidemic and other diet-related diseases while raising healthcare costs exorbitantly. After years of changing the wording, New York City's health department amended the city health code to require the posting of calorie counts by chain restaurants on menus and menu boards. This started a national revolution and is the reason why we now see calorie counts at most restaurants. Do you know how much salt, also known as sodium, you consume in one day? Research indicates that the average American consumes 3,400 milligrams of sodium each day. Can you guess the recommended maximum daily intake for salt? It is 2,300 micrograms. Chronic excessive sodium intake is a risk factor for multiple chronic diseases such as diabetes and heart disease, and that is why it is so important we monitor our sodium intake. So where is all this sodium coming from, you may be wondering? High amounts of salt hide in places that we may not realize or be aware of, such as fast food, condiments, baked goods, candies, and other processed food. Extra salt is added to these popular foods by food production companies to add flavor, not necessarily with their knowledge and consent. Tom Farley, Frieden's replacement for head of the health department, started the National Salt Reduction Initiative to get producers to reduce sodium intakes in their products. Tom Farley stated that sugary drinks have accounted for approximately 40% of the sugar people eat and between a third and a half of the total increase in calories in the American diet over the past 30 years. Children and teenagers are at a particular risk of obesity related to sugary beverage consumption, and sodas have been successfully eliminated from school vending machines since 2009. The health department's educational campaigns, such as Pouring on the Pounds, raised awareness of the added sugar in sugary drinks and their association with weight gain, obesity, and diabetes. This reduced sugary beverage consumption of New Yorkers from 36% to 23% in 2013 and started a national conversation.